Okay, here we go with another Lippy Q of the week. Dr. Amron, how can you determine when it is lipedema or when it is just gaining weight? So very good question. I mean, this is where I think that everybody should begin to understand this so we can properly diagnose patients. When is it just gaining weight, or when is it just maybe obesity, and when is it truly lipedema? So we've talked about this again in another segment. Diagnosing lipedema is not the most difficult thing in the world. It's based on really three different areas. Number one is a pattern of distribution. It's a unique pattern in lipedema patients that presents in a predictable way. Typically it's circumferential, involving entire cosmetic units. The legs can have a column-like look. It can involve the upper buttock area. They can be more of a triangulated pattern, sparing the ankle area. The upper arms are typically involved. So it's a pattern of distribution. It's not just being overweight. Many times the patient is both. They can be both overweight and have lipedema. And we've talked about this also, that many patients, they get more advanced or stage 3 lipedema, will begin to lose the metabolic battle with lipedema and begin to put on weight in other areas and become overweight. And it's those patients that many times just get diagnosed as being overweight and do weight loss surgery and stuff like that, and lipedema doesn't change. So it's important to distinguish that. So again, pattern distribution, number one. Number two, symptoms. Patients without lipedema don't just have sensitivity when you press on their tissues. Most patients with lipedema do. They're having some degree of pain, not all. The easy bruisability, the swelling, the hyperextensibility of joints many times in patients. So it's, again, some of the signs that you see with lipedema and symptoms. And then finally, you will tend to see a family history almost always on the mother or an equal frequency of the father side of the family to see a pattern of inheritance. And that's what I use to diagnose lipedema patients. So again, being overweight and being lipedema are two different things. Use those things I just talked about to help guide you in figuring out what is what. But many times, again, you're not going to be able to just simply always diagnose yourself, even though many patients do. I've said this, many patients come to me because they've done their own research, because nobody's picking up the diagnosis. And then they realize, I call it the aha moment, oh, I think I have lipedema. And usually I got to tell you, when patients think they have lipedema, they usually do. It's kind of, if it smells like lipedema, it probably is lipedema. So thank you for your question.